Scroll through any comment section, and you will see the word narcissist thrown around casually to win arguments or describe cartoonishly evil people. Behind that casual buzzword is a complex, diagnosable clinical reality: narcissistic personality disorder. The patterns of this disorder develop early, typically solidifying by young adulthood. The condition is pervasive. The symptoms present simultaneously across multiple areas of a person's life, disrupting family dynamics, straining close friendships, and the workplace. Treating a clinical diagnosis like an internet insult actively prevents us from understanding the true mechanics of the disorder. On the surface, narcissistic personality disorder often presents as a pervasive pattern of grandiosity. A person might act out to assert dominance, or they may retreat into a persistent internal fantasy of unlimited brilliance and power. This grandiosity drives an intense need for constant admiration, coupled with a deep sense of entitlement regarding how others should treat them. Because individuals with the disorder have a profound difficulty feeling empathy, they often form interpersonally exploitative patterns, using others as tools while experiencing intense envy toward anyone else's success. While the public sees an abrasive, exploitative exterior, this behavior functions as a rigid defense mechanism designed to protect something hidden entirely from view. Clinicians call this vulnerable narcissism. Underneath that tough exterior sits a fragile self-esteem. Minor critiques bypass normal psychological filters, striking directly at their sense of self. The intense preoccupation with status is an unconscious strategy to aggressively seal off that fragility from external judgment. The specific actions society labels as villainous are actually desperate, maladaptive attempts to stabilize a deeply unstable internal state. When an individual with the disorder perceives a threat to that fragile core, they often react with an explosive burst of anger or despair, a response clinicians call a narcissistic injury. Existing in a constant state of hypervigilance against perceived slights creates a life characterized by deep, private suffering. The effort required to maintain the grandiosity is depression and anxiety. The reality of narcissistic personality disorder relies less on malicious plotting and heavily on an agonizing, inescapable psychological vulnerability. A diagnosis does not guarantee a permanent outcome. When a person engages genuinely in the process, real, measurable change is entirely possible. Clinicians treat the disorder using specialized, evidence-informed approaches, including psychodynamic therapy, schema therapy, transference-focused psychotherapy, and mentalization-based treatment. Engaging in these therapeutic frameworks benefits the individual experiencing the disorder, while critically improving the daily lives of the people who love and interact with them. Safely dismantling grandiose defenses to rebuild a fragile core requires the intervention of a licensed professional. Coping and Healing Counseling offers that professional solution through a 100% HIPAA-compliant telehealth practice, serving all 159 counties in Georgia. They maintain a diverse, culturally competent team of over 15 licensed therapists, bringing together clinical social workers, professional counselors, and marriage and family therapists. Their comprehensive services encompass individual, couples, and family therapy, alongside teen therapy for ages 13 and up, and dedicated life coaching. This clean financial breakdown chart shows exactly how accessible treatment can be. Medicaid patients have a $0 copay, and those on major commercial plans, such as Aetna, Cigna, Blue Cross Blue Shield, United Healthcare, and Humana, pay between $10 to $40 per session. Stop throwing labels and start navigating these patterns with professional help. Visit chctherapy.com or call 404-832-0102.